Hey guys, how are you? This is Jim Prusak, physical therapist from the Pain PT, and we're going to go back to basics today and look at the cause of mind body syndromes, the cause of TMS, the cause of chronic pain, and a lot of somatic symptoms that don't have a physical origin. And really, what we're looking at is this one word, and the word is stress. Now, when I'm taking a history of somebody, I want to find out what was happening around the time of injury or the time of symptom onset and find out what type of stress was happening to the person. Now, typically we think of stress as only being a physical stress or physical load on the body, and that can cause pain, like doing too much of a physical activity, overexerting yourself, lifting a weight that's the body can't handle, repetitive strain injuries, things like that. Okay, but when I'm getting people's histories, many times, and most of the time, there isn't a physical stress. We cannot link up a physical trauma or physical cause. So when we can't, find a physical root to the problem, we have to go to other levels of stress that can also cause the same somatic symptoms and pains in the body as physical stress. And this is mental and emotional stress. So, what was happening, what was going on in the person's life around the time the symptoms started? Was there a lot of stress happening in some form or fashion for that person, whether it be an event happened, a traumatic event, or something in their lives at the time that was creating a mental emotional stress, which then created a physical symptom? We have to remember that mental and emotional stress can cause the very same symptoms as physical stress. This is the thing that modern medicine is missing. We know from the studies that indicate that 75 to 95% of all doctors' visits are for stress related causes, stress related symptoms. Now, that's a staggering statistic. How many doctors are asking you about your stress, your mental and emotional stress? Not too many and not enough, because when we get a person's history, I'm looking to find out again, what is the cause? Was it a physical stress that caused it? And if it was, the body should be able to heal in a certain amount of time. Unless it's severe, then the person needs surgery or other medical attention. Now, when there's clearly no physical cause and the timeline has gone beyond a normal time frame for physical healing, then we have to look towards mental emotional stress. And I hear these stories all the time, different reasons, different situations, but there's been some type of emotional or mental sort of insult or load or stress to the system, and that typically can kick off these physical symptoms. So, what are some types of external stress that can kick off physical somatic symptoms in the body? Well, it can be anything from financial stress, relationship stress, including your family, including your partner, work, school related stress, home stress. There can be a whole number of external stressors going on in your life. Situations you're in, people you're with, could be a one time traumatic stress, could be an ongoing low level load of stress at the time, an accumulation of little stresses that are happening. And we can also look towards internal stressors. So, internal stressors are your own mind and how you think and operate. So, if you are a people pleaser, if you're a perfectionist, if you are someone who is a do gooder, always trying to please other people, if you're somebody who is over conscientious, over responsible, somebody who overthinks, over analyzes, tends to worry excessively, has anxiety, these are the qualities of internal stressors that can also create a, a system in your body or create a state that can cause somatic symptoms. So, a lot of times it's a combination of external and internal stressors. These are mental and emotional stressors that can cause a chemistry in your body to shift into an inflammatory state, and that can cause somatic symptoms. So we have to decipher whether the cause is physical or the cause is mental and emotional, or maybe a combination. Now, like I said before, when you've had a physical injury, the body should heal. The body has a timeline for healing for most conditions. As long as you take care of your body during that time, the body will recover and pain should go away. Now, sometimes there is a physical injury, but there's also a lot of mental and emotional stress around that time or ongoing now at the current time that can keep an acute condition alive to become chronic. Okay, so I don't think the medical world is giving enough attention to these mental and emotional stressors that can cause very real physical symptoms in your body. We tend to just look at the physical. So ask yourself what stressors were going on at the time of your pain or the time your somatic symptoms started, internal and external. Was there any physical stress at the time? How long have your symptoms been going on for? If they're going on past the normal time frame for healing and there's no severe structural changes in your body that you can pin it to as a physical cause, then you need to look more closely at the mental and emotional side of things. And that's what I help people with here at the Pain PT, is that we want to bring together a whole picture of your situation so that you can move forward more clearly with an approach that can address the stressors that are going on for you. All right, I hope that was helpful, guys. I want you to really take to heart this mental and emotional stress is exactly the same as physical stress in terms of creating somatic symptoms. It's exactly the same. They're all on the same shelf in terms of what they can create in your body. All right, take care.